want to start out by just saying good morning to everyone again. I'd like to say TGIM. I'm trying to popularize being just as excited about Monday morning as we are about Friday morning. I shared that with our district superintendents recently, and one of them said, "Good luck." And I said, all right, I've got one person on my team. All right, we're going to talk this morning about a culture of shared leadership. I want to start out really by thanking all of you and just expressing my gratitude for the work you do on behalf of the children, youth, and families in your respective communities. It is complex work, it is challenging work, but it is so important and so rewarding to work on behalf of other people's children to try and ensure that they receive the same kinds of opportunities that we want for our own children and the children of neighbors and families that we love so dearly. This morning, Gina's going to join me in just a moment, but I'm going to start with just sharing with you some of the work that we're engaged in Yolo County around integrated systems, around, as Richard mentioned, this notion of disrupting the fragmentation that currently exists in our system. And so my comments to begin with are going to be grounded in a project that we've been working on for the last 3 years. And we're excited to be at a place where the first 3 phases of this work is done. And we have 2 really important markers to point to. One is that recently we published and released a countywide needs assessment. This effort was funded by 5 school districts, 4 cities, the County Board of Supervisors, the County Office of Education, and UC Berkeley. And what many of our staff have begun to refer to this as is a 185-page love letter to the children and youth of Yolo County. Right. So as we think about the proverb that it takes a village to raise a child, what this is for us in Yolo County is one of the ways that we're reimagining the connection and the shared responsibility of that village to our children. And we're chasing a vision where one day, for every child or youth born, cared for, or educated in Yolo County will be advantaged as a consequence of the community's response to their developmental needs. So imagine a day where simply being born in your county becomes an advantage for those children because of the way that the adults in the system have decided to aim our efforts at their needs. So as we think about shared leadership, I'm going to just take a little bit of a different tact maybe and ground my comments not only in the technical aspects of shared leadership. This definition comes from a sort of slimmed down version of the document that Elizabeth and others have published related to the various pillars of building this integrated work. This definition is very important in that it addresses many of the operational and strategic priorities of shared leadership. The thing that I want to add to it is the cultural aspect. In other words, if we think about culture as the dominant way that people think, feel, and behave in the system, related to authority, related to planning, related to strategic oversight and issue resolution, I would argue that the type of culture around shared leadership we want to build is one in which we in the system, when we're engaged with one another, come to the conclusion that I'm safe with you, that we're connected, and that we have a future together. So everything that I share from this point forward really is to try and provoke that kind of thought process in our relationships, in our interactions, as we go about some very technical aspects of our work. but never losing sight of the importance of a relationship and a culture where more and more people in the system conclude for themselves that I'm safe, we're connected, and we have a future together. So why does this matter in this moment? As has already been stated and established, we are in a historic period of change. We have a tremendous opportunity through funding and policy objectives that are truly aimed at disrupting the predictability of school failure, for instance, along the lines of race and socioeconomic status, right? These are beautiful policy objectives, most of which either explicitly or implicitly call for some level of cross-sector collaboration. However, our system, as has been alluded to, has not been rooted in those practices. If you think about the family game Hungry Hungry Hippos, and those marbles representing money, resources, power, influence, that's really what our traditional orientation around our work has been. We compete with one another as opposed to cooperate with one another, traditionally. If we reorient those marbles, rather than resources, we think about those as parts of the problem, that I have expertise to aim my resources, aim my understanding, aim my work at, then we're all now starting to, as hungry, hungry hippos, chase after those problems together and clearing that board of those issues in a cooperative fashion. So I'm an analogies guy. I have come to think about these policies that we're chasing. For those of you who are policy wonks, CYBHI, AB 2083, right? The policy objectives that we're chasing are what makes up this beautiful bouquet of policies, right? These policy objectives, this idea that we want to ensure greater access to high quality childcare and preschool. We want to assist every foster youth who is transitioning out of care to do so in a fashion that really supports their access to employment and housing and food security, higher education, right? All beautiful things. The challenge is that bouquet, if I am thinking about it from the standpoint of the weightiness of this bouquet relative to our system's readiness, this is how I think about this. The bouquet of sort of policies at times is overwhelming, right? At times there's this weightiness, and that child there that's holding up this bouquet is how I think right now of our system's readiness for this work. Some of the pressure that we're experiencing in the system that continues to sort of weigh us down and pressure us is the fact that many of our reform efforts are coming with pretty tight timelines in terms of standing up collaborative infrastructure, right? In some cases, we have about 15 months or 18 months to stand up relationships to ostensibly, transform the system. As was mentioned earlier, we also have situations in which we have staffing shortages or turnover within the system. And that also provides some pressure in our ability to transform what we think about as transform our system in such a way that we can bring about the kind of change that we're seeking. What we have found in our work in Yolo County, and we think it likely has applicability across the board, is in terms of what's happening on the ground related to why shared leadership is so important. These issues have plagued us for many years, that there's either a lack of understanding of what's already existing in the system, a lack of access, and there's some support that's needed related to navigation of the system. We have a responsibility to continuously look at how we can improve the implementation of our work, or as has been a major focus of breaking barriers, this issue of integration has served as a plaguing challenge, and then obviously sustainability. In our work context, the traditional way that we have approached our work has really been from a more of a compliance lens. So as was pointed out earlier from our partners with San Bernardino, whether it's at the state level or the county level, one of the shifts that we recognize is taking place now is moving from sort of a compliance mindset and or from providing technical assistance or professional learning in sort of a diffuse way into a space where we're actually trying to reinvent and change the system. That's new work for all of us, right? And I think it's important for us to recognize the tension that exists in a system in which we're bringing folks together across sectors in a way that that challenges our traditional notions of leadership, challenges our traditional notions of power, challenges our traditional notions of boundaries as well. So in our system, in a analog clock, gears might get stuck, right? In a car, pistons might get stuck. In our systems, people get stuck. And what we're arguing is that the kind of culture we're trying to bring about, this culture in which I feel over and over again that I'm safe with you, that we're connected, and that we have a future together, the more people who understand how to get themselves unstuck and how to get other people unstuck will assist us in moving our work forward. So I'm going to advance to moving into a few tools that have helped us get ourselves unstuck in Yolo County. So when Elizabeth called me and asked me to present this morning, shared the theme, making it real, I'm gonna share with you all how we are truly getting after this notion of shared leadership and a culture in which we can demonstrate vulnerability with one another, as well as advance this work together. So this first tool is a tool that allows agencies to come together and really understand, once we've developed a shared vision of what we're trying to accomplish, how best to aim our respective capacities and capabilities at that issue or that goal. This represents a true exercise that the County Office of Education and the Public Health Department engaged in. So going from left to right, you see that or from your right to left, as it were, you'll see the list of capabilities or capacities that are needed. We developed that list together. And then on the right-hand side, those two columns where you see the red, yellow, and green, independently, each agency then identified either whether we had a high capability, mid-level of capability, or little to no capability in those particular areas. What that allowed us to do, about 30 or 45 minutes it took us, it allowed us to really understand the strengths and weaknesses that we have across our agencies, as well as to understand more clearly our interdependence that we hold for one another in executing towards our vision. Very practical. The second tool that we're using, again, thinking about how do we keep people from getting stuck or to get themselves unstuck in the system, these triad meetings for calibration. So imagine in a traditional hierarchy or in a traditional way of approaching issues, a superintendent, meeting with the assistant superintendent that's supporting student services and is in charge of community schools. They meet on a regular basis to explain or to calibrate and to ensure that they are on the same page related to the priority of this work. That assistant superintendent or that deputy superintendent then carries out that message to the community school coordinators at all of the sites. For us, what we're finding is more powerful is to bring those folks into the room at the same time for calibration, right? So that there's an opportunity for us to hear directly the questions that come up, the issues that surface, what's happening on the ground. It can't happen all the time, but we're recognizing that when we're calibrating for the sake of clarifying priorities, for the sake of clarifying direction, it is incredibly important to have the heads in the room together. And for us, we highlight this notion of triads because at a minimum, we're finding that at least 3 folks should be in the room together, right? Who are holding responsibility. And then the final tool I'm going to share with you, this is a responsibility charting tool that we're using when we launch a project. On the right-hand side, no, it's still your left if you're looking up front. Thank you. Try to orient myself here. On your left hand, starting left to right, that task list may have 15 different tasks, 20, 30 different tasks. Along the top, you have the names of each of the members of that particular team who are working on that project together. You can't read the teal and blue and purple letters, but those colors represent the before, during, and after portions of a project. The teal colors provide direction related to who should be contacted before this project gets started. And so these are ways that we have found, despite the complexity of the work, has helped us to move things forward and help us to get unstuck. I'm going to end this portion of the conversation with this grounding quote from Donella Meadows. If you're not familiar with her work, 1972, she wrote a beautiful piece called Thinking in Systems. And what Donella says is that there's too much bad news to justify complacency and just too much good news to justify despair. And so what I'm going to do is invite Gina Daleiden up, my partner with First Five, and we're going to hear about some of the good news from First Five Yolo County. Let's give Gina a big round of applause. Can you just give us a high-level overview of the project, what its intentions are, and how that's going?
Yes. And I hear you saying high level because Garth knows me well. He's on my commission, and he knows that I'm very passionate about the project and could talk about it for a very long time. So Welcome Baby Road to Resilience was developed very intentionally as a cross-sector birth equity project. The aim is to improve maternal and infant health and safety, and it is particularly targeted to Medi-Cal and uninsured population and our residents in Yolo County. I will say, because I see here in the room, and I saw you before I came up here, Kim, a shout out for just 10 seconds to my colleague, Kim Gall from First Five Orange County, because this project stood on their shoulders with some leading edge work that was done in Orange County. So, yes. So Welcome Baby, I'm taking something very complicated and trying to make it simple. You bet. Is essentially a large in-clinic, in-community navigation and in-home visiting effort. There is limited duration nurse home visiting immediately postpartum. And then for families who want and need more intensive, longer duration home visiting, we have two different pathways for that, very centered on families and child development, and focused on our highest risk population, many of whom have behavioral health or substance use issues.
Great. And Gina, so when you speak about this cross-sector collaboration, just give us give us some of the partners who you're working with, and share with us the manner in which shared leadership is manifest in your work.
Welcome Baby Road to Resilience has many, many partners that you will maybe see on a slide here soon. There are 3 founding partners. The Road to Resilience piece, or that more intensive, longer duration home visiting piece of the project, was started about 6 years ago by First 5 Yolo, Yolo County Children's Alliance, and Communicare Health Centers, which is now Communicare plus Olay. And the 3 heads of those agencies, this really is a true story, drafted the outlines for what we wanted to do together at a long lunch on the back of a napkin. And it was informed by evidence in the field, and as I said, models that we saw elsewhere. Excuse me, elsewhere. But the relationships that we had that existed among the 3 of us was really critical to getting the project off the ground. As we started, we very intentionally reached out to multiple sectors, including law enforcement, County Office of Ed, Health and Human Services at the county, and some various healthcare systems. When Welcome Baby was added, which is the nurse home visit, more broad-based, the idea was to destigmatize services and really offer it to all families who were eligible, Medi-Cal or uninsured. We needed to network all of the healthcare systems serving those residents in Yolo County. So we now have medical systems partners. We have 10 different medical systems who are fully on board and active in the project. You see the implementation partners that I mentioned previously, Communicare Olay, Yolo County Children's Alliance, Dignity Woodland Hospital, are all supplying the direct services or the direct-to-client services in the project. UC Davis and LPC Consulting help us on evaluation, and then First 5 functions in this very, I think, emerging role in a shared leadership project. Garth, as you've seen, where we're kind of the hub for holding together the project, for helping with CQI, thinking about how we iterate, and then we're drawing funding from multiple public funding streams, and we're leveraging and braiding that funding as best we can, trying to integrate differing eligibility, differing time frames, and all of the reporting and data collection requirements in one place, so that when it comes to our partners who are working very hard directly with clients, we're trying to streamline as much as possible. And I'll just leave this last piece, that the project incorporates parent voice as much as possible, and really trying to center on the needs of the family. And that drives some of that two-way communication that we try to keep with state agencies who are funding, with the county, with our local cities who are funding, and then with the First 5 Commission for our Prop 10 funds.
So funding from cities, go through those funders again for us, Gina.
Yeah, I'd be happy to. I hope I don't forget anyone.
Sure.
So the pilot for this whole project started with a little bit of funding from First 5 Yolo, and a little bit of funding from City of Davis. And then we expanded countywide with a small pilot with a large grant from CDSS, Office of Child Abuse Prevention. That was a 5-year grant that has now grown into another 3-year with an option of 2 years, so I'm going to call it 5 years. Another 5-year grant from CDSS, Office of Child Abuse Prevention, and they have been amazing partners. We have funding from County of Yolo, from City of West Sac, City of Woodland, from Yolo County Office of Ed, from the Yolo County District Attorney, Sutter Health, and others that I may forget or that I'll eat into our time. So I'll stop there. But there are multiple funders, and And we just received a CYBHI grant, so don't want to forget that.
Congratulations.
Yes, and that will contribute to that project as well. And we are, one more little piece, we are transitioning to also be able to bill Medi-Cal. That is very different for this collaborative project and for First Five. So we're now fully enrolled as a Medi-Cal provider.
Can you share with us some of the challenges as it relates to shared leadership in this project and how you all have worked through that?
Yeah, I think early on, some of the challenges had to do with just merging very different sectors and very different agencies. So social services, medical systems, that integration was difficult. It was difficult on the ground with those who are serving. I apologize, my voice. I'm getting over a little something. And working through workflows that were different, expectations that were different, and then literally merging the teams on site together. You know, where am I going to sit? How do I fit in a clinical team if I'm a social service worker? And then First Five's role really emerging as a partner that is trying to coordinate and in some instances direct, but at the same time working very hard to co-design and to iterate together. I think in the shared leadership category, still evolving 6 years later, is how do you define and redefine roles and responsibilities, particularly as we're not only chasing what we know will work, what we've found works with families, and that changes over time, but also chasing the funding streams to try to sustain what we know is having an impact from our data. It's clearly having an impact, and it's harder and harder to fund, particularly with the decline of the funding of Proposition 10, which is First Five's more flexible funding. So as we move into this world, for instance, of CalAIM and Medi-Cal billing, it puts First Five in a supervising provider role, which is a little bit different, particularly as we work with our FQ. Clearly, they have the expertise on the medical side, and our social service partners have the expertise in the parent education and so forth. So all of us really aligning and then realigning. For our staff, it's daily, and for leadership, it's easily multiple times a month where we're communicating.
So you mentioned your staff, Gina. Can you share with us, as you think about this integrative work, and from a shared leadership perspective that requires shared leadership really to be expressed at every level of the system, how has this impacted or shaped the way that your organization does its work, even from an internal perspective?
Yeah. As I mentioned, it is daily work, and my team, particularly my program team, is working in a way where they're not only working with their colleagues at First Five, but they are working with many other staff who hail from other agencies. So that has required very intentional and co-created workflows together. A lot of communication and feedback whenever we iterate. And I'll tell you, on the ground, they want to iterate all the time, almost too quickly, sometimes for leadership, as we look at, what are the parameters around the project and the funding streams. I would add to an ongoing challenge, Garth, it's simply the infrastructure of the agencies themselves and the institutional requirements that we all have, particularly for public agencies, which is First Five, and our public agency partners, our public agency funders. There are a lot of trappings that go with being a government agency, and a lot of requirements that simply have to be met, and we are trying to break barriers, to be out of the box, and going into that kind of crossing into that new frontier. Sometimes our institutional requirements are a little bit behind that. So we've had to address that with a lot of legal maneuvers. The way that we use our, shape our contracts, our MOUs, that type of thing.
Awesome. Let's talk about the results.
Okay.
What kinds of results are you getting that are noteworthy? So that we've talked about that, we've discussed the challenges and the trappings and working through those challenges. What's been the reward?
The reward has been great, and it's why everyone hangs in. I mean, I guess I also want to say this, and a shout out to my closest partners in this work, that I think above all, we have shared values. We have a pretty laser-like focus on what we want to do for families. And as we've entered this space together, we've learned more and more about what families really do need and what will work for the outcomes that we want. So we can see that integrating services the way that we are has allowed the medical system to offer more than just what they would typically be able to offer within the confines of the clinic itself. And our social service partners have learned more and more about mental health. They've learned more about how to best access specialty care or care that referrals that they might need to make. And for the welcome baby piece, because it's so broad-based, it has really opened up the entire perinatal population that we're targeting. In terms of our outcomes, I have lots and lots of data. You're welcome to go to the First 5 YOLO website and take a look at our infographic. But I can tell you that the outcomes for mothers and infants in this program are 30 to 40 to sometimes 75, 80% better than those in the similar population who were not served. So we're talking about HEDIS metrics that we know make a difference, and we're talking about the ability to not need to enter child welfare services.
Awesome. Thank you, Gina.
Yeah,
Shared leadership. Yeah. It is the path to better outcomes. And what I'll share with you just to drive the point home as a commissioner, when Gina mentions that the outcomes for folks who are served through this system versus those similar populations, we're seeing increases in well child visits. We're seeing increases in mothers breastfeeding, right? So very tangible, very impactful outcomes for the well-being of our young people now and into the future, right? So Gina, thank you so much for joining us, and thank you for your important work.